Hemophilia do's and don'ts. Hemophilia is a type of blood disorder where there is no factor is there. So there is a chance of bleeding after cut injury. There is a large blood spot here and there in your body, and there is a bleeding from the joints and also your muscle. Then you can suffer from the hemophilia. After confirmation of the diagnosis by the factor assay, you have been diagnosed that yes, I have a hemophilia patient. But the something has to be very keep in mind that following has to be strictly followed. Do's and don'ts. Don'ts mean the first and foremost important thing is that you should avoid the outdoors game or the contact sport because you have a chance of more injury. Second is do not take intramuscular injections. Third is that do not take unnecessarily the aspirin and also the different painkillers, and do not take the unnecessary medicine without the prescribe of your doctors. So these don'ts has to be followed carefully, because if you don't follow, your chance of bleeding symptom will be the more. But what will you do? The do's is that you have to be tested for factor level. You do your regular consultation of the factor, then you get rid of your bleeding symptoms, and you do the brisk exercise, you do the swimming, you do the cycling. There is no chance of increasing your bleeding symptoms, and you take paracetamol from your consultation of the doctor if you have a pain in your any part of the joints and bleeding. So please follow the do's and don'ts of the hemophilia. Then unusual unnecessary suffering of the hemophilia you can be avoided.